Well, thank you for joining us. Can one vaccine help two people? For pregnant women, yes. Local 5's Carson J.S. Reichart spoke with medical experts today about why they're trying to make sure expecting mothers get the COVID vaccine.
COVID vaccines obviously help the person who gets them, and there's been a lot of conversation about how those benefits extend to other people. Now, that connection is being taken even further from expectant mothers to their future children. Iowa healthcare providers are teaming up for the Give Your Baby Its Best Shot initiative, encouraging pregnant women to get the COVID vaccine. According to the CDC, pregnant women and women who recently gave birth are more likely to have severe symptoms from the virus, but only about 25% of pregnant women are vaccinated. Getting the vaccine is completely safe, both for mothers and their children. Dr. Neil Mansinger explains why.
These drugs or chemicals have to cross the placenta to cause harm to your baby, and the vaccine does not cross the placenta. So you do not have to be worried the vaccine can cause any problems to your baby.
Mackenzie Parker is a mom who got the vaccine while in her third trimester. She sees the vaccine like all the other health advice she followed while she was pregnant.
Just like any other prenatal care that you get during your pregnancy, you really want to take care of yourself and your baby, and this is just another way to keep yourself and your baby safe.
If you still have concerns about how the vaccine works and how it could impact your baby, there's no one better to ask than a medical provider that you trust.
I want to urge you to please share your questions and your concerns with your medical provider. Trust their professional guidance on receiving the COVID-19 vaccine.
Finally, none of the medical specialists today had any recommendations for which specific vaccine a pregnant woman should get. Any of them will get the job done. In Des Moines, this is Carson J.S. Reichart for Local 5 News. We are Iowa.
The nation's largest association of pharmacists continuing to call on Americans to get vaccinated. According to data from the CDC, nearly 65% of Americans 12 and older are fully vaccinated. With booster shots starting to roll out for some Americans, we asked if people should expect to experience side effects like the ones reported with both the first and the second shots.
I would anticipate we might have a little bit of a reaction because we're boosting our immune system again. So you might have the fever, the chills, a little bit of aches and pains, maybe a headache, things like that are pretty common with shots if we do get that booster, just because we are boosting up that immune system, making sure that our immune system is ready to take on virus if we do end up catching the virus.
The American Pharmacists Association says the share of Americans who will not be getting a vaccine is around 14%. That stayed relatively the same since December. Still, 1/4 of unvaccinated adults say they will likely get a vaccine before the end of the year.